The dorsogluteal injection site is located in the superior lateral aspect of the gluteal muscles. Nurses are familiar with this site, and it is traditionally a favored spot for depot injections. Some of the disadvantages of the dorsogluteal injection site include the presence of major nerves, such as the sciatic nerve, and blood vessels. Some studies have suggested that the distance between the skin and muscle in the dorsogluteal region is greater than the standard needle length used to administer IM injections, especially for women. The standard needle length used for injection in the dorsogluteal region is 1.5 inches. If nurses feel this is not sufficient to reach the muscle, a 2-inch needle can be used. The right needle length depends on the patient's size, but it is recommended that if the gluteal site is to be used, longer needles should be considered. The patient's adipose tissue can also have an impact on the length of the needle and should be part of the nurse's overall assessment. A 2-inch needle would be required to deliver an effective IM injection to obese patients with a BMI of over 30. Like other IM injections, injections into the dorsogluteal muscle should be given into the densest part of the muscle at an angle of 90 degrees. Recent authors have specified that the ideal dorsogluteal injection site is located between 5 and 7.5 centimeters below the iliac crest. The most recent literature strongly advises that the upper outer quadrant be redivided into quadrants, and that the injection be given in the upper outer section of the upper outer quadrant, so landmarking is done by making a double cross. Note that the sciatic nerve is located near the inner lower section of the upper outer quadrant. Bunching may not be advisable for dorsogluteal IM injections because bunching can affect the skin to muscle distance and therefore the required needle length. As with all IM injections, it is recommended that nurses use the Z-track technique for dorsogluteal injections. The Z-track technique is effective in decreasing leakage through the subcutaneous tissue. In order to make use of the Z-track technique, the nurse should use their non-dominant hand to pull the skin and subcutaneous tissue 1 to 1.5 inches to one side of the injection site prior to injecting. This creates a disjoint perforation or broken injected pathway that locks the medication into the target muscle, preventing flowback.